So let me introduce myself. My name is John B. Chagas, and in this video, I'm going to present to you my research paper, and it's all about the effectiveness of family planning policies, the abortion paradox. So let's get started. So this is my research paper, the effectiveness of family planning policies, the abortion paradox. So let's start from the table of contents. Introduction or introduction opening statements, thesis statements, body, they have two supporting details, conclusion or the closing statements, and the citation and reference. Introduction. Understanding how abortion rates change over time is critical for driving sexual health strategies. The relationship between contraceptive use and the incidence of abortion, as Marson and Clark 2003, an American sociologist point out, is a source of passionate controversy. Some say that contraceptive prevalence raise abortion rates fall, while others argue the opposite of the truth. If in 2011, many of the inconsistencies are likely due to omission, the most prevalent underlying reason are fertility intentions for taking contraception and having an abortion in contraception fails. Understanding abortion trends in the light of changing contraceptive strategy necessitates a true understanding of the process that leads to abortion, and that abortion is the culmination of process that begins with sexual activity and continues with the use or non-use of contraception, all of which contribute to the likelihood of an undesired pregnancy, the decision to terminate an undesired pregnancy, and the requirement to access the healthcare system to complete the procedure are the next step in the process, with abortion is legal. This study assessed contraceptive habits, pregnancy plans, and abortion options, looking into the effects of contraceptive distribution in changing motherhood norms on abortion rate, as well as the usefulness of abortion rates as a reliable indicator for monitoring family planning policy. This socio-historical approach offers the people with a unique opportunity to contribute to this critical scientific and public health decision at a time when the effectiveness of family planning strategies in the beginning of the question. Body. Contraceptive practices. Research includes the family planning dealing the spacing pregnancies is linked to improving birth outcomes for babies, either directly or through healthy maternal behaviors during pregnancies. Contraceptive methods have a range of benefits other than primary purpose of pregnancy prevention. Contraception reduces pregnancies-related morbidity and mortality, reduce the risk of developing certain reproductive concerns, and can be used to treat many menstrual-related symptoms and disorders. In addition to contraception, a range of other beneficial health services are available to the clients at family planning clinic. Services to prevent, screen for or treat diseases and the condition of such as chlamydia, gonorrhea, HIV, HPV, and cervical cancer, as well as to address intimate partner violence, benefit both female and male clients who visit these clinics because not all women have equal access to the many benefits of contraception and other health services. There is more work to be done in implementing programs and the policies that advance contraceptive access to improving health outcomes for all women. Unwanted pregnancy rate. Based on obligatory reporting of abortion in the Philippines, The all-over unwanted pregnancy rate was calculated as the sum of national unwanted birth and abortion rate, assuming that all abortion was unwanted pregnancies. The abortion rate was divided by the undesired pregnancy rate to get the likelihood of terminating an undesired pregnancy. In 2008, the Philippines had 1.9 million unintended pregnancies resulting in unplanned births and unsafe abortions. 13 in the Philippines, 37% of all births are either not wanted at the time of pregnancies or eitherly unwanted, and 54% of all pregnancies are unintended. On average, Filipino women have more than children. They have decided highlighting how difficult it is to have women to meet fertility desire. This is especially noticeable among the poorest Filipino women who have twice as many children as they wish to have. Conclusion: trends in the usage of effective contraceptive techniques have been linked to a decline in the number of undecreased pregnancies. However, among the youngest women, the likelihood of terminating undesirable pregnancies increased over time, but it reduced among the older women. Abortion rates are the outcome of a complicated process that is influenced not just by contraceptive access and the effectiveness, but also by shaping procreative norms that influence the decision to terminate an unwanted pregnancies. As a result, rather than using abortion rates when evaluating family planning policies, undesired pregnancy rates should be examined. Citation and reference: Andrew A. Bauas and Barzon M. Balazar and Laborde, 2010, Changing in Sexual Behaviors per Scholar's Trend to Public Health Policies AIDS. Bauas N. Guilherme A. Cuntula O. 2003, Productive Health Behavior of Young Europeans, Counseling of Europe. Bencoli A. Tosi O. Costalina J. Singa S. More A.M. 2011, Managing Unplanned Pregnancies in 5 Countries, Perspective on Contraception and Abortion Decision, Global Public Health. Klein J. Marson C. 2003, Relationship between Contraceptive and Abortion, a Review of the Evidence, International Family Planning Perspective. Efren A. 11, Inducing Abortion in Tehran, Iran, Establishment Rates and Correlates, International Perspective on Sexual Reproductive Health. Hazon C.M., Current Miserable Contraceptive Methods, a Global Perspective Obstacle. Singha S., The Untitled Pregnancy and Introducing Abortion in the Philippines, Cause and Consequence, New York Guttmacher Institution in 2006. And that would be all. Thank you.